So welcome to the kind of workshop this morning on exploring health inequalities with iaptus data. So I'll just briefly talk about health inequalities, setting out what they are, how the NHS proposes to tackle them, and what dimensions of health inequality or protected characteristics exist. Just helping to frame the types of data challenges and analysis we want to or need to do, and kind of give us a bit of a framing for those activities a little bit later on. So what are health inequalities? A few quotes. So Bernardo say that health inequalities are avoidable, unfair, and systemic differences in health between different groups of people. And the term refers to differences in access, experience, and outcomes of care, as well as the opportunities to live a healthy lifestyle. NHS England says that their vision is to deliver exceptional quality healthcare for all through equitable access, excellent experience, and optimal outcomes in response to the healthcare inequality. So just wanted to give a really brief overview of policies that NHSE have developed over the past few years in terms of health inequalities. So first off, in 2019, the long-term plan set out some key actions that the NHS would take to do more on health inequalities. Long-term plan asked every local area to set out specific measurable goals and mechanisms by which they will contribute to narrowing health inequalities over the next 5 to 10 years. And some examples of these specific actions included cutting smoking in pregnancy, ensuring people with learning disabilities and or autism get better support, and providing outreach services to people experiencing homelessness. And in 2020, we saw the Advancing Mental Health Equality Strategy, which summarised the key actions to bridge the gaps for communities faring worse than others in mental health services. It was also an important element of the overall NHS plans to accelerate action to address health inequalities in the next stages of response to COVID-19. And then in 2021, in January, the NHS National Inequalities Improvement Programme was established. And this programme works with other programmes and policy areas across NHS England and is responsible for setting the direction for tackling health inequalities, creating a positive improvement culture, and using data to target action to reduce and prevent healthcare inequalities. Later in that year, there was the Core 20+5, a national NHS England approach to inform action to reduce healthcare inequalities at both national and system levels. The approach defined a target population, the Core 20+, and identified 5 focused clinical areas requiring accelerated improvement, which I'll talk a little bit later in the next slide. Then in 2022, the Women's Health Strategy set out a 6-point plan by which over the next 10 years will radically improve the outcomes for and the way in which the health and care system engages and listens to all women and girls. And then in 2023, the NHSE Statement on Information for Health Inequalities Data gave a statement standardising the approach for collecting, analysing and publishing information on health inequalities by specifying a key set of data indicators that trusts and ICBs are expected to monitor and report on within their annual reports. And just a little more information on the Core 20+5 framework. So the Core 20 are the most deprived 20% of the national population as identified by the National Index of Multiple Deprivation, or IMD. IMD has 7 domains with indicators accounting for a wide range of social determinants of health. Focusing on this group of patients across all areas of healthcare ensures that the outcomes for the 20% most deprived are monitored and improved. Plus, the plus population groups should be identified at a local level. These may be ethnic minority communities locally, people with learning disabilities and autistic people, people with multiple long-term conditions, other groups that share protected characteristics as defined by the Equality Act, among others defined at a local level, applicable to all areas of healthcare where these people seek help and support. And the 5 refers to the 5 clinical areas of focus which require accelerated improvement. Although common mental health disorders are not one of these clinical areas, we see how these are applicable in talking therapies through the integration of long-term conditions in talking therapy. Many talking therapy patients will have many of these conditions. So when thinking about the core 20+ population and identifying which communities to target for improvement locally, the World Health Organization has defined 22 dimensions of health inequality, some of which are listed here. It got too big for the slide. So we're seeing things like age, ethnicity, disability, but also things relating to employment and poverty as well. And then there are also the legally protected characteristics under the Equality Act, which help us to identify those communities for targeted intervention for health inequality improvement. Some of these overlap with the World Health Organization dimensions of health inequality, such as age and disability. So that's the overview of health inequalities. Hopefully we're all on the same page. So the next section of this workshop will focus on understanding your data challenges in relation to health inequalities. So we're hoping to get your feedback on data challenges that will help us to inform areas for future data analytics projects and help us prioritize existing projects. So we want to understand what you're trying to achieve with the data within your service and whether there are any particular problems that you would like to address with the data collected by your service and whether Mayden can support you in that. There are ones that you are seeing coming up and you really identify with that, please do copy.
It's difficult to identify and analyze things outside of your own experience. Yes, and part of developing the analytical side of iaptus is about allowing services to investigate what their clinicians are saying, what the sort of anecdotal evidence is, and trying to see if there is evidence of that in the data set.
I'm just going to run through some of the dashboards that we've already got on the system that may be able to help you when looking at health inequalities and investigating those in your service. And also hopefully give you an idea of some of the work that we've got coming up in this area. So let's start by going through a few of the existing workbooks. The first one is called Referrals and Discharges. This is a large workbook with a number of different dashboards in it that allow you to look at all sorts of different information about your patients. So a couple of examples, looking at the Referrals tab. When we go into that, the first thing you do is just set the sort of group of the cohort of patients that you want to look at, so the time period. What you can then do on this particular dashboard is you can break it down by 2 different characteristics or different metrics. So in this case, broken it down by reliable recovery, whether people reached it or not, and ethnic category. So what we get when it's plotted is every bar is broken down by that first item, the reliable recovery, and then there's a different bar for every group in the ethnic category. So yeah, that allows us to compare the recovery rates across ethnic categories. Now, obviously, there's lots of different ways that you can split the data. There's lots of things that appear on these drop downs. So it's worth exploring to see what you can do. And there's also the option of using the filters over here, which allows you to make it so that it's only looking at a certain group. So if you wanted to restrict it to patients from 18 to 25 or something like that, you could do that via the filters and then continue using the dashboard as normal. Let's move on. Also in the referrals and discharges workbook, we can examine the number of sessions that people are having on average during the course of treatment. So in this case, we have still got it broken down by reliable recovery and ethnic category. But for example, these plots here, this is showing the average number of contacts for those people who show reliable recovery. It's got the average number of contacts, and each dot represents a different ethnic category. So you can clearly see there where there's major differences. Just to say, this is dummy data that we're looking at, so some of the things that show up on here might not quite make sense. Next up, it's still in the referrals and discharges workbook. I did say it was a large one. We can look at the first and last scores comparison, where up here we can set just the time period and the group of patients we want to look at, and then we can say what we want it broken down by. Again, we're going with ethnic category here, and what the large plot is showing is effectively the response to treatment. It's how much of a change there has been in the depression score and the anxiety score for those people who have finished treatment. And each dot represents, in this case, a different ethnic category. And the size of the dot also indicates the volume of patients that are included in that data. So there's a lot of information here, but it could really, flag up outliers and groups of patients that are either showing very good response to treatment or very poor response to treatment. Okay. Last one from the referrals and discharges workbook is this very useful tab showing where you can just pick, again, you can pick two different metrics or characteristics. So we can see up here we have selected age band and ethnic category, and what it will do is it will build you a table detailing the recovery rates or reliable recovery for all of the different combinations of those groups. So if we want to see the recovery rate for Asian patients who are between 65 and 74, we've got that here. Again, it's dummy data, so there isn't actually much data in there, but with a much larger data set like you'll have at your disposal, this could be really useful. And again, obviously you can explore which different characteristics are available via the drop downs to investigate what you need to investigate. Next up, a different workbook. We have the contacts workbook, which is specifically to look at the sessions that people have attended or not, and the volume of sessions. Real application in here to health inequalities works, looking at attendance to identify any cohorts of patients where engagement is poorer. So on this tab again, we can identify two different sort of characteristics about those referrals. In this case, we've gone for setting the first dimension as attended or did not attend, and the second as ethnic category. So again, similar to in when we looked at recovery earlier, we get each bar is broken down by the first dimension of the attendance reason, and then you get a different bar for each of the second dimensions there. So we can very quickly look at all of the different kinds of attendance for all of the different ethnic categories across the selected period of time. Then we have the IAPT wait times workbook, which displays information about how long people have waited for their first contact and also for their second contact. So quite straightforward, really. Again, we can identify those different groups that are of interest when looking at health inequalities work, and we can see how long they've spent waiting for their first contact, so for their assessment, and then we can see the subsequent wait after that. And there's various different controls that you can change, or different targets that you can put in there, such as these up here. If you need any support using any of these workbooks, because there is a lot to take in, then do just please raise a support log, and we can help you with that. Next up, we come to a workbook which isn't available to all services. We have developed this as part of a pilot that we're running called iaptus Insights. This is us piloting the idea of a central analytical service which produces certain outputs like dashboards and reports for those services that want to sign up to it. So we've developed this maps tool, and I'm just going to show you what that looks like. So the couple of ideas that are behind the maps workbook are that firstly, it's about showing information geographically, so that you can see in the area that your service covers, you can see metrics plotted on the local map, which makes it much easier than, say, reading off a table of different localities, to identify what is going on in the area, what the impact on different metrics are of living in certain towns or certain areas. The second part about it is that it's bringing in another data set as well. So it's not just looking at your patients and the volumes of them coming into the service and their outcomes. It's also bringing in census data. So you've got data available about the local population. And yeah, joining up those two data sets means that you can get a better idea of perhaps groups of people who aren't accessing the service as much as you would expect them to, that kind of thing. So in this example here, this is just a map showing, and this is census data that's been pulled in from the 2021 census. This is the percent of the population who are disabled under the Equality Act. So this allows you to clearly look at that and instantly see, right, well, there's a far higher proportion of people living along the coast who are declared disabled under the Equality Act. There is also facility in the workbook to compare the maps alongside each other. So in this example, again, just looking at two census metrics, but there are also service metrics in there, such as referrals received, initial severity of PHQ-9 or GAD-7 symptoms, attendance rates, those kind of things. But yeah, in this case, we're just looking at population density on the left, and then the percentage of the population who are not white British on the right. And that allows you to see, where the real differences are between those maps. There's a lot of information to explore on this particular workbook. If you wanted to, as I said earlier, this is available under iaptus Insights, which is currently running as a pilot. If you wanted more information about that or wanted to get involved, then either raise a support log, and that will get to passed on to the right people, or you can email directly to iaptus.insights@mayden.co.uk. Moving on to our sort of ongoing work around health inequalities. Some of the key areas that we're looking into are producing simple displays, which focus on giving you the information that you need to compare, because most analysis is about comparing different things. We don't want you to have to get information from lots of different sources. We're trying to pull it all together so that you can see it in one place. We also recognize the importance of deprivation, and we are bringing that into some of our dashboards, so that and developing new ones so that we can show your service data through that lens of deprivation, allowing you to filter data by that or break it down by different deprivation groups. And we're also looking into extending our benchmarking capabilities, which I'll mention in just a moment. So that the top point around simple displays. So this table shown here is just a mock-up of the kind of thing that I'm talking about, where you select the category of a characteristic that you're interested in. So in this case, just broad age band, and we then build functionality that pulls data in from multiple different sources and performs calculations on it, that sort of thing, to give you all of the information that is of interest in the one place. So we've got the population data from the latest census. Then we've got some service metrics of total percent of total referrals and the percent of total treated. Then we've got something that's calculating based on the census data and your service data. So looking at the proportion of the local population who have accessed the service in a given period of time. Then we have the more standard service metrics, so that you've got all of this in one place, so that you can draw multiple conclusions or identify multiple issues just from one simple table. Then in terms of showing deprivation, is so important. It's a key part of the Core 20+5, and any work on health inequalities will talk about deprivation. So we have the data available in the system. That work has already been done in bringing in the indices of multiple deprivation, which are defined by lower super output area, so we can apply that to patients, and the kind of information that we want to be able to put out there is things like this, where you again picking a category to look at, and then just displaying the difference between the breakdown of deprivation in the population for a given category group compared to the breakdown that you're seeing in service around those people treated. So in this made up example here, it's showing that actually for 18 to 24-year-olds in the population, a large percentage of those are in the lowest two deprivation quintiles. But actually, in terms of the people who are being treated in the service, there's some sort of issue there in that those people aren't accessing the service in the volumes that you would expect based on the population. But that's how this kind of deprivation information could be presented and could be helpful. Finally, from me, just a quick word about national benchmarking. We have a called the IAPT National Benchmarking Workbook, which it's got multiple dashboards in it, but one of the things that it shows is this sort of ranking of providers for key measures. It's based on the monthly data that is submitted by all adult services, but there are also quarterly publications which have more information around that is sort of pertinent to health inequalities. They have information around ethnic category, age, long-term conditions, work status, presented complaints, so that there are fewer metrics but much more to break the data down by. So we're looking into extending this kind of benchmarking workbook to include that quarterly data as well, so that you are able to look for your service and filter by, say, different age groups or ethnic categories, and compare against other services throughout the country, because this is all publicly available data, so we're fine to do that. So yeah, that's an exciting piece of work, which again we hope could be really helpful in informing discussions around health inequalities, which is what all of this is all about. That's it from me. If you have any questions about this, do please get in touch with us. Raise a support log, or email us on iaptus.insights@mayden.co.uk, and we'd love to discuss this further with you. Thank you very much for listening.